Happy Friday, everyone. We are here last week. We were here with an educational advocate. This week, I am so happy to have Gayle Byck with us. She is the founder and the principal at InTune Health Advocates. And wow, nothing could be more important than having a health advocate during COVID. I mean, it's important normally, but now during COVID, it's got to be, you would be a godsend to me. Tell us a little bit about what you do exactly.
Sure, Betsy, and thank you so much for having me on this week. You kind of stole my intro there.
Oh.
I was going to say that our healthcare system is really confusing and overwhelming and complicated in normal times, but here we are with COVID, and it's even more so, especially when there are such restrictions on having someone with you in the hospital or at a doctor's appointment, and you had to go it alone. And if you're dealing with a really serious illness, that's tough. So basically what I do is I help people navigate their way through the healthcare system and with their health insurance. For some examples include going to doctor appointments with people, helping make sure like that communication with their providers is going well. You may or may not be surprised to know that people forget 50 to 80% of what the doctor tells them by the time they walk out of the door, and they don't know what to do.
I am sure. I am sure. In a normal conversation, I think that, I don't know what the statistic is, but they only get a little bit of it. And if you're stressed,
right, then
remember anything.
I can remember going to one appointment, it's a bunch of oncology appointments with someone who was around our age, and she was so overwhelmed with fear of the diagnosis and all this information coming at her, that it was just, so good to have someone with you to take notes, but to help you think ahead of time of what you want to get out of the appointment, what questions you want to ask, and then help you wrap it up at the end. So to make sure that you're clear. A lot of people are scared of asking questions. They don't think they can. And so having someone with you can help with that. And even prepping ahead of time helps with that.
Well, that's really important. Prepping ahead of time so you can have a conversation about, most people don't even know what to ask. But
I tell people it's like a business meeting.
Yeah.
And you should prepare for it as if it's a business meeting. And on average, you get 11 minutes with the doctor.
Wow.
So if you can go in there with your list of issues in priority order and your questions written down, then you're not going to get so frazzled, when you're actually there and you have to ask the questions and make sure you have all the information. And then you want to know what are the next steps. When you leave the room, you want to know what happens next. In my experience with doctors, they really appreciate you just asking there and getting through everything, because otherwise what happens? Later that day, you're going to call or you're going to send a message through your patient portal, and they're going to have to take time later to do it anyways. So really, it helps everybody. So that's one example of things I do. I help people coordinate their care and what resources they need. I've had numerous clients who are older adults, and their adult children don't live in this area. Or maybe they do, but they're so overwhelmed with their jobs and their young kids that they can't do it all. And so I can help coordinate those needs. And if someone, say, wants to be able to stay in their home, there are a lot of resources out there that can allow them to do so, but you have to know about them. It takes time to set them up. You have to stay on top of some of those services. So, helping to coordinate everything is another role. I help people research different treatment options, clinical trials. I've saved people lots and lots of money when they've gotten denied by their insurance company for services that should be covered, or they've gotten huge bills from providers that don't seem to make sense. I recently got to make a great call to a client who had $30,000 in bills. And after, you got to be persistent. This took almost a year with Blue Cross and with the hospital system, but at the end, he owed $0.
Wow.
So
Wow. And I'm just sitting here thinking, I bet they make a lot of, I personally just got a bill for a surgery, and it wasn't a lot, and it said it denied this thing, but I never had a surgery. So what are they talking about? It was like a few $100s, and it was from 2019. I'm like, what is this even?
Right. So another statistic to throw out at you is that 80% of medical bills contain an error, at least one error. Yeah.
And we don't know how to read them.
We don't, and they're not descriptive. It might just say surgery, or it might just say procedure.
Right, and I'm looking at thinking, what did I have last year? I don't remember.
Yeah. So you got to really look at your bills and follow up and ask questions and know what questions to ask and keep on it if it doesn't make sense to you. This client I just was talking about, he wanted to negotiate the bill this summer because just having that bill hanging over you is stressful. Right. And I kept telling him, it's your call, but I'm telling you, in this case, you shouldn't have to pay. There are some times when you do have to pay, when everything's legit and we have these deductibles. That's how our health insurance is set up, and you got to pay your deductible. Yes. Right. But there are other times that things happen when you shouldn't have to pay.
Well, this is really the thing that it's like everything in medicine, not only is it scary, it's a different language. There's so much. I know in my business, we assume certain things because we have information. The average person hopefully does not have experience with this. Right. And there's so many nuances that you can sift through. They don't need to reinvent the wheel.
It's so true. It's so true. And with the insurance, sometimes it's just speaking their language, like you said. Yeah. Knowing the right phrases to use, and it kind of puts whoever you're talking to on notice that you know what you're talking about.
Exactly. That, because.
And how some of the systems work, and even just having contacts higher up in some of these health systems, because if you call the number on your bill, the person you're talking to, is a lower level, customer service representative. And I'm not disparaging them, but they don't necessarily have the authority to help you or the knowledge. Like there have been times that I've talked about different statutes that exist in Illinois that protect the consumer, and that person probably isn't going to know about them to be able to, make the change for you or help you get it through the system.
Right. So, tell us more. I was going to ask some, questions about your background, but why don't you just tell us?
Okay. So I've had this business for 3 years, and my previous career, I was a health services researcher at Northwestern University. Okay. So I've got a lot of background in research and understanding data and in communicating data. As I mentioned communication already, and I've always had this idea that most of the problems that exist in our healthcare system are because people aren't communicating well with each other. Right. And so it's just being able to clearly say what you mean, ask questions when you don't understand, and figure out, how to work with everyone. And it's about being proactive and assertive, and not adversarial, but assertive, and making sure you get your needs met. There's just so much confusion out there. And as we already mentioned, when you're scared because of what's happening with your body or your mind, then it's not a time where you process information well. So everyone kind of just needs to be aware of how they're giving information and making sure that the other person, is understanding that information. That goes a long way. The other plug I want to give is how important it is to do your advanced care planning. Because when and especially during, COVID, because there's a lot going on with that. But also, as I mentioned earlier, you're often not allowed to have anyone with you if you're in the hospital. And somebody needs to know what your wishes are. Make sure you designate your healthcare power of attorney. I've experienced situations and heard about situations where that hasn't been done, and that just makes really complicated stressful situations that much more complicated and stressful. So I just want to put in a little plug for people doing that.
Absolutely. And kids at college, they have to have, once you're over 18, it's not just, my mom. I mean, that doesn't work. Isn't that
My
correct?
oldest kids, we filled out the forms before they left for their freshman year of college, and my youngest will be 18 next week, and I've already got the form sitting on my desk for when he turns 18 next week.
There you go. There you go.
As soon as you're 18, you need to have that filled out.
Yes. Is there something else that could, you'd like to add, or?
Something else that's good to do in every situation, but certainly now, is have your health information organized. So just like you want to have your healthcare power of attorney designated in those forms, you should have all your important health information, organized in a binder or folder, your emergency contacts, the names of all your providers, your medications, your allergies, how to log into your portals.
Oh, yeah, because I was going to say, so for me, luckily, but all that is in my portal.
So if you were in the hospital and you weren't, aware enough to be able to get in your portal, who's going to be able to get in there?
Right, but if I gave, so what I'm saying is, maybe you can keep it all in your portal, but make sure that other people can log into your portal.
Yes.
Okay.
Make sure someone can log in. And I still like to recommend that people take time to even, old school, have a hard copy. What if someone has trouble logging in? What if you wrote down the password wrong for them?
So a hard copy of what? Like who all my doctors are?
Who all your doctors are, your medications, your emergency contacts, whether you have who your healthcare power of attorney is, and a copy of that form, a one-pager about your medical history, like, bullet points, what's going on now, what are the key things in an emergency, what are the key things someone would need to know about you. And that can be hard to find in your portal. You have to go back and forth a lot.
Yeah, and here's what I'm thinking. People are healthy, so they don't do it. Hey, I take a vitamin D and I blah, blah. Okay, so then they start getting sick and they do whatever they're doing. And then all of a sudden they could be in a totally different, and now they've forgotten everything and they've got all this jumble of papers, and who the heck knows?
Right. And say you end up at a hospital that isn't your usual hospital. Right. Now, all these different portals, these electronic health records, are supposed to be able to talk to each other, but sometimes there are glitches. And so somebody should know that, hey, you're allergic to penicillin, don't give her that.
Right.
Those kinds of things happen. So it's part of preparing. And no one ever wants to do it, and it's something you put off, but it is a good idea to get that information organized.
That is, I think that's a good COVID project for people. The winter is coming, and they're going to be looking for activities, and they can get their health care emergency
information binder. Yep.
Information binder together.
Another advocate I know calls it an ice pack. In case of emergency, ice, and then it's your pack, your ice pack.
That's great. Get your ice pack ready, and that'll force everybody to see their estate planner or get the form to get those, because it really does. And I'll tell you something, I like to mention this every once in a while, for wills. In the state of Illinois, it is currently a law, this is what I've been told, that you must have a wet signature and a hard copy of your will. So if you have a PDF somewhere, it's no good.
Huh.
Did you know that?
I did not know that.
I found that out. So it's really important that you know where your hard copies of your parents' wills are. Because you don't want to have to go into, giving the government a whole bunch of money. And
yes, it's not good enough to have done your financial stuff or your healthcare power of attorney and will if nobody knows where it is.
Exactly. Exactly. So, well, your business is certainly. It's like one of these things where I'm sorry that people need to have to use you, but I am thrilled that people have you, because I couldn't think of anything. When we were dealing with my mom, it took all three of us.
Right.
And, it was a very short period of time. And it was like the three of us were sitting there. And if we didn't have the three of us, I would have gone nuts.
Mm-hmm. So, it's a lot of work. Really. Right. And so I always say my goal is, one, to make sure people are informed and supported and empowered, but also to just help people get through a difficult, stressful situation and make things easier for them. Because as a neutral, outsider, it can just be a good perspective and keep things calm.
Absolutely. I mean, I think that perspective is huge, that you've seen things before, and you're sort of like the way you said to this gentleman, do whatever you want, but I'm telling you, I can get you this money. This is the law, so just hang in there a little bit longer. So, I mean, I do the same thing in my business today. I said to somebody, this guy wants your house. Emotionally, he wants your house. So that's a good thing, So those are the things we learn. So, I want to thank you for being with me today. And I want anybody who's watching to know that they can email you at Gayle@InTuneHealthAdvocates.com, all one word.
Correct.
And then your phone number is on my YouTube channel. So they can find that. You can go to Betsy Phillips Realty YouTube. That's my YouTube channel. They can get to know you. They can find your phone number, and they can text or call or email, I'm sure, if they have any questions.
Thank you so much, Betsy, for having me. It was a great conversation.
Thank you so much for what you do. I like I said, I hope I don't need you, but I know
hope so too.
I am sure that I will send you people to make their lives that much more easy. So
thank you.
Everybody
so much.
Have a great weekend, and we'll see everybody next week. Thanks, Gayle.
Bye, Betsy.
Bye.